been dispatched to a 56-year-old male hit by a vehicle.
All right, PPE, BSI, is my scene safe?
Scene is safe.
All right, I'm gonna call for ALS backup. My number of patients is 1. My general impression is that I have a 56-year-old male that's been hit by a motor vehicle. I'm going to have my partner take C-spine. Is my patient conscious?
Patient is unconscious and unresponsive.
All right, and I'm gonna start with my ABCs. Does he have a patent airway?
He has gurgling respirations at 6 a minute.
Okay, so I'm going to suction my patient's airway until it is clear. I'm going to insert an OPA and I'm going to start bagging him or have my partner bag him once every 5 seconds. I'm going to then check his circulatory. So what is his skin condition, and does he have a pulse?
He has a weak and rapid pulse and his skin is cool and clammy.
Okay, noted. So I'm going to decide that he has a rapid transport at this point. I'm going to do a rapid assessment. I'm going to check his head. Do I see any or feel any blood or deformities?
No blood or deformities noted.
Anything on the back of his neck?
Nothing noted.
I'm checking for tracheal deviation or JVD.
Nothing noted.
Okay, I'm going to apply a cervical collar at this time. I'm going to then check his chest for any gross abnormalities. Do I see anything?
Nothing noted.
I'm palpating the abdomen.
There is bruising noted to the lower left quadrant.
Okay, noted. His pelvis, I'm checking his pelvis.
It is mushy.
Unstable.
All right, so pelvis is unstable, so I'm going to apply a pelvic binder. Going down the legs, do I feel any blood or deformities?
No blood or deformities noted.
Alrighty, and does he have pedal pulses?
Bilateral equal.
Alrighty, so I'm now going to put him onto a backboard. I'm going to roll him, and as I have him rolled, I'm going to check down the back of his spine and do a quick sweep of the back. Do I notice any deformities or blood?
Nothing noted to the back.
All right, now that he's on a backboard, we are going to get him loaded into the ambulance. Once in the ambulance, I'm going to have my partner take a set of vital signs. Can you give me those vitals, please?
So blood pressure is 190/120. His respirations are now normal on the bag. Pulse is still 120 beats per minute, weak and rapid.
Okay, noted, and I'm going to start my secondary assessment. So I'm again going to check the head for any instabilities and any drainage from the ears, nose, or mouth.
Nothing found.
All right, I'm going to check his eyes with my light. Are they reactive?
Equal but slow to react.
Alrighty, going to check if his shoulders are intact, his clavicles and his sternum,
Everything's intact.
his ribs.
Intact.
I'm going to get lung sounds at this point.
Bilateral equal and clear.
Perfect. I'm going to again palpate the abdomen, starting furthest away from the bruised area. Has the bruising gotten worse, better, the same?
Bruise is a little bit bigger.
Okay, I'm gonna leave the pelvis because it's in a pelvic binder. I'm gonna do a good assessment of the legs, making sure that there's no broken bones, any blood loss, anything like that.
Nothing noted.
We still have pedal pulses.
Yep.
Because my patient's skin was cool and clammy, I'm going to also treat for shock by covering him with a blanket. He's on oxygen, we're transporting to the hospital. I'm going to reassess vitals every 5 minutes, keeping a close eye on him. Once I get to the hospital, I'm going to give a report of a 56-year-old male hit by a motor vehicle. We intact C-spine. He has a cervical collar on and a pelvic binder for instability. We have been bagging him once every 5 seconds with a BVM at 15 liters per minute. He does have bruising to the lower left quadrant of the abdomen, and his pupils are slow to react bilaterally. And I think that's it. Yay.
Great job.